Good evening. Today's FB Live session is about dengue awareness and all we need to know to fight this killer disease. And we're very happy to have with us today Dr. Vasanth Kumar, pediatric intensivist at Apollo Children's Hospital, Chennai. Good evening, doctor.
Good evening.
What is dengue?
See, dengue is just another viral illness. Like any other viral infection, dengue is as simple as that. It is just a viral infection. But the problem with dengue is it has a wide spectrum. It can range from mild asymptomatic, that means the patient will not have any symptoms, to extent it can go till it can cause even death. So that is dengue.
And what will be the signs and symptoms of dengue in a pediatric patient?
So since in this session we'll be discussing only about children, so children are a high risk group, as you all know, because they are prone to get easily infected. The signs and symptoms can usually range from a fever. It is usually a febrile illness. The child can have a fever for a couple of days associated with some vomiting, abdominal pains. Dengue is as such called a break-born fever. So which means the patient will have some body aches, myalgia. So fever, some vomiting, abdominal pain, aches and pains. These are the usual symptoms of a typical dengue infection. Sometimes they can even have headache. Classically, some people can describe retroorbital pain just behind the eyes. So these are the symptoms which can be seen in a dengue infection.
And how is dengue detected in early stages?
See, dengue by and large, for experienced practitioner, will be a clinical diagnosis. So if you see any patient presenting to us with fever and this GI symptoms like abdominal pain, vomiting, and some aches and pains, we suspect clinically that the child can have a dengue infection. Once we suspect that the child can have a dengue infection, then we end up doing some basic blood investigations like a complete blood count, and if required to confirm, we do dengue serology and NS1 antigen detection test.
It is often said that dengue is seasonal. Is it true?
Yeah, it is partly correct. How I would like to label it is, as the audience is aware that there's something, a terminology called endemicity. That means some areas are prone, like they live with that infection. So with respect to dengue, if you see, Chennai is considered as a hyper endemic region. That means always at some point of time, like right from the month of January to December, there is always some dengue cases in the city, either in Chennai, Tamil Nadu. So everywhere there is some dengue infection. But during rainy season, like for Chennai, if you see, it is classically from July to November. So during that season, the number of cases increase exponentially higher. So there is always a baseline dengue cases which are running. But during the season, like July to November, especially in the rainy season, the number of cases increase much higher.
And it is predominantly in children?
No, it can affect anyone. It can affect right from a newborn, just born child, to an elderly, 80 year, 100 year. I mean, it can affect anyone. Children are the vulnerable population, but it can affect anyone, each and everyone.
Can dengue be transmitted?
See, dengue is a viral infection, but usually a classical of viral infection is droplet spread. But dengue is an exception to that. It is a virus, but it is transmitted only by mosquitoes. So unless a mosquito bites you, an infected person, and comes and bites you, that is the only way the dengue can get transmitted. It is absolutely not transmitted through like shaking hands, talking to an infected individual, or sharing the same space, same bed space. I mean, you share the same bed, share the same towel. It does not, transmit dengue infection. So it is not a transmittable disease through interpersonal contact.
We have a question. How do we differentiate between a normal fever and that it could be dengue?
So as we all discussed, dengue is predominantly a GI illness. I mean, it causes some vomiting and abdominal pain along with fever. And usually in children, once there is fever, in between the fever, the child generally tends to become normal for some time. But if you find the child in between fever is still a little tired, lethargic, and the child has some vomiting and pain abdomen along with aches and pains, then I think if it is crossed especially 2 or 3 days, then you think of there is a possibility of dengue illness. And another differentiating feature is if there is cough and cold or some URI like symptoms, upper respiratory symptoms, it is less likely to be a dengue infection. I'm not saying it cannot be a dengue infection. If a patient has, if a child, for example, has a fever along with cough and cold, the chances of it being a dengue is less likely, though I will not rule it out completely. If the same patient, if the child has a fever along with some vomiting or loose stools and abdominal pains, generalized body ache for 2-3 days, then I would rather suspect dengue, especially in the season of July to November.
And what are the risk factors for dengue infection, doctor?
See, as you all discussed, it is a mosquito bite which is causing the problem. So, I mean, being in Chennai or Tamil Nadu itself is a risk. Like everyone, like all of us in this room are at risk of getting dengue infection. So there are particular age groups, I mean risk groups, I would rather describe, who are at higher chance of getting dengue. Even in pediatric, suppose for pediatric age, we say it is from 0 to 18 years. So even in that, the infants, especially infants meaning it is from 0 to 1 year, they are more prone to get dengue, and it will be a severe form of dengue if it happens in the infancy. Similarly, adolescent more than 10 years are at a higher risk of developing dengue, and once they develop, it will be a severe form of dengue. People who are obese, overweight, again are a risk group. So these are the risk groups. If you come to general population, it will be like diabetic people, people who are old age. They are again at risk of developing a severe form of dengue. But if you ask me just the risk, everyone in this room is at risk of dengue, and especially if you have like a lot of mosquitoes in our house, again that is a risk.
And how serious can dengue be in children?
See, dengue more or less, if you see, like 80 to 90% of the patients will just have a mild febrile illness, just like any other viral fever. It'll just go 4-5 days, it'll last and just settle on its own. But there are some people, for the unlucky ones, who end up having severe forms. So this is a mosquito bite which has entered your blood. Since it has entered your blood, it can go to the entire organ system. It can affect your heart, lung, brain, kidneys, liver. So that is what we call it in medical terms as multi-organ dysfunction. So it can affect each and every organ of your body. So when it affects each and every organ of your body, suppose if it affects your liver, the patient can go into liver failure. If it affects your kidney, he can go into kidney failure. If it affects the brain, it can cause brain fever. So each and every organ can get affected. But the main problem with dengue is the blood which stays in the blood vessels. The blood vessel is a tube-like structure. Instead of being in the tube, it leaks out. That is classically called a capillary leak. So the blood leaks out. Instead of blood being in the tube and giving it to the different organs, it just leaks out to the outside. Thereby the blood pressure tends to come down, and there is a phenomenon called shock, meaning this much amount of blood is expected to go to the tissue. If the blood flows to the tissues, that is when we survive. Because the blood leaks out, the blood flow to the tissue is affected, leading on to a situation called shock, where it causes tissue damage. If this tissue damage continues for a longer time, the patient can even die. So dengue can lead into shock, it can affect multiple organs. Another severe dangerous complication is bleeding. The patient can have catastrophic bleeding. So these three things are the major complications in dengue.
What are the treatment options for dengue?
So again, it depends on the severity. So if it is a milder form of illness, just fever, the child takes adequate nutritional intake, especially hydration, good hydration, along with management of the fever with antipyretics. So good hydration with management of fever is good enough to manage patients at home. Suppose